Okay, I'm going to open the subcommittee work session on House Bill 1192 relative to the Board of Acupuncture Licensing and relative to the qualifications for licensure as an acupuncturist. And I handed out, anyway, so I learned Wednesday afternoon, I got a call from Representative Schmidt, who had spoken with, I don't have the name offhand, but whoever chairs the acupuncturist board, that there's a Senate Bill 282, which was dealt with acupuncture, but then they amended it, and I've passed out the amendment replacing the entire bill with this amendment. And it ends up dealing with the same issues that we were trying to deal with in 1192. And, oh, sorry, I forgot that Representative Grota wasn't in. I'll start over again. I'm sorry, fellows.
I'm gonna get my, oh, you don't have your name, please.
I didn't see him.
Are they in the office? Is there? Are they sitting out there? Yeah, I should have done that. We are I know. I was going to, given the overview, I wanted her to hear. But we can discuss it. Yeah.
It looks like the amendment is a almost carbon copy of our bill. Is that right?
Well, it deals with one issue that we didn't, which is who gets, or that I don't recall being in ours, maybe it is, who gets to call themselves an acupuncturist and under what circumstance you can advertise as a, you can't advertise as a physician or doctor unless you actually have a doctor as a doctorate of acupuncture or something. But the bulk of it is dealing with the requirements for licensure and renewal. And so I also got a phone call from one of the two ladies here who from, you know, the acupuncturists who were two of the top ones in the state. And she told me that the acupuncturists in general were completely happy with this amendment to Senate Bill 282. And, you know, if you like, we can look through it and discuss it. I had only one section I had maybe some question about, but what I think I'm going to propose is that we retain this, and Carol McGuire has been involved in the discussion, that we retain it and see what the Senate does. And, you know, if, in any way, if the Senate, and by the way, Senate Bill 282 with amendment is actually on the Senate consent calendar for the next time they meet. So the committee's already voted out OTPA unanimously. So I expect it to come out of the Senate. I expect it'll come back to this committee anyway. So we'll have a chance to look it over in detail if we want. But I don't see any point in proceeding with 1192. Do you have a view?
Yeah, Mr. Chair, this is not the only time that a bill has followed parallel tracks in the House and the Senate. and I would say it's not over till it's over, and that what the Senate does is what the Senate does, and we should pay no attention to that. We should make this bill what we think it ought to be. I would be perfectly amenable to our amending it to be identical to Senate Bill 282, and then at the end of the day, they'll decide which one becomes law, and it won't really matter.
I'm not opposed to that. The only thing I'd say, it's not an early bill. And so we can, if we want, hold on to it as it is and then decide to amend it or whatever we want to do.
I don't have
later.
a problem with delaying exacting the bill until later in the session, but I think to basically sending it to interim study just because of the Senate bill covering is not a viable option.
Right. I'm not, I didn't make myself clear. I'm not suggesting interim study or even a formal retain, but just the committee hold on to the bill for now.
But that would be fine. Would you like someone to prepare an amendment to make it identical to 282?
Sure. You're welcome to do that.
I'll be glad to take care of that.
Okay.
Before we do that, could we
Yep.
just have a chance to look at both of the amendments? I'd like to look at it in
certainly.
relationship. So,
And actually, I had one section, and I only had a chance to read this amendment first, I think, yesterday evening either, so, and I know you have less. Yeah, if anybody can look at it. The only, I had a couple questions, one on the second page, starting at, section 2s and 3, where it's naming, not so much 2, but 3, where, I guess, well, this is all ors, so it's, issue a license. So yeah, issue a license to one who satisfies, reach the age of majority. They added or equivalent certification approval to the active NCCAOM certification, and I know the acupuncturists had an issue with that organization. Left the fee amount to OPLC, which is good. Made a minor change to D. They added some other options under E1. And
One difference is that they, in our bill, we have licensure by passing the Kale exam, and in the Senate bill, they left that out. But there's the option for equivalent certification approved by the board, so they could adopt that same process through rulemaking. I don't see that as being a substantial difference.
right, I agree. I think, putting too much in the way of specific organizations or standards becomes a problem for the future as things change. So I agree. Let the board deal with it. So I looked it over last night and a little bit today. I don't offhand have any issues with it.
I do think that, well, I'm not sure. Do we have to, before the end of the period, our House period, before crossover, do we have to make a formal recommendation to retain the bill
Well,
until the next, until we receive the Senate bill?
I don't think we can retain the bill in the second year. Someone can correct me if I'm wrong about that, but we do have to vote out some recommendation.
Right.
And I think the options would be, ought to pass with amendment, ITL, maybe interim study. I think we will see before crossover what the Senate does. I think my understanding is they're going to have a session the same week we do. And so we'll see the results at that point.
So we're just going to hold on to the bill until we see the Senate bill, and then we can, if we need to, amend the Senate bill or accept it as is, right?
Right. I mean, that's my
Okay.
suggestion. We'll get SB 282, assuming the Senate passes it, which looks like it will. It'll come to us anyway. And then we'll have 1192 as well if there's some reason we feel we need to do something with it.
But don't we have to report out 1192 before crossover, and we get the Senate bill after crossover?
The Senate will have voted on the bill before crossover. They will have voted, I believe, the week that we're doing the votes on the early bills, right? So the week of the 15th, somewhere in there, when we have session, I believe they are as well that week. And they'll have voted then, whether or not to pass this OTPA. And we'll know that at that point. Now, whether formally the bill's before this committee at that point, I don't know, I think we can actually get bills before crossover if the Senate's done with them. But at least we'll know, and if it looks like the Senate did something wonky, we can decide to move forward with 1192 at that point.
Well, the deadline I'm looking at the deadlines for the House calendars, and this bill is not going to a second committee, right?
So we're not,
The deadline is February 24th to act on House bills not going to the House committee.
let me see if I'm misunderstanding something here. No, the 24th is the last day to act on House bills going to a second committee. So that's the deadline for the House to act on.
I'm so sorry, I
Early
was
bills.
reading the last, it's March,
It's,
March 17.
right. No, that's to act, to report. March 10th is the last day to report. So that's for the committee to report on bills not in a second committee. So we have until March 10th.
Right.
Right, to do something with 1192. And if we're completely happy with 282 and the Senate passes it, I mean, we could ITL or interim study or whatever this seems appropriate with 1192. But if not, we can amend it and recommend it.
We can also just pass an amendment identical to Senate Bill 282 and let the Senate decide which one they're going to let become law.
I don't,
That's usually what has been done in other committees that I've been
yeah,
on.
I mean, I'll leave that up to the chair. As far as I'm concerned, I'm fine either way. So does anybody have an objection to just recommending to the committee that we hold on to this bill until the Senate acts on 282 and then decide what we want to do? Okay,
No issues with that.
okay, great.
And in the meantime, I'll prepare an amendment as you suggested so that we can make it identical to 282 and then we have that in our pocket. We can do
Right,
that.
and if for some reason, which I don't expect, somebody finds some problem with the amendment to 282, we can always redo it or whatever. Okay, I'm going to close the work session on House Bill 1192. And I will open it for the work session for House Bill 1563, requiring state employees to be enrolled in the deferred compensation plan. And I don't have strong thoughts on this one. Does anybody want to have any thoughts on what to do with it?
I've had several conversations with people, and it's funny because there are people who have no opinion about it at all, people who think it's a good idea, and people who don't think it's a good idea. And people who don't think it's a good idea is because they think that there are other plans that people could get into that would be better than the government one. So, and what this plan does, it doesn't prevent them from doing that. The only really difference in the plan is that you have to opt out of the plan as opposed to opting in. And is that perceived as a mandate, I guess? That's the word that I guess thrown around, and I particularly don't like that word, but I don't know what else, what other term to call it, but I would say that 30% of the people that I've spoken with are in that category, and the other 60% are in the great idea or I really don't care idea group. So that's the feedback I've sort of taken a poll of different age groups and different political affiliations, and it's really sort of maybe something people haven't also thought about before.
Yep. Okay, thank you. Anybody else?
Yeah, my question is whether this bill is even necessary because people can enroll in this plan at this point in time. I do have an issue with automatically enrolling people in this because people don't always pay attention. If we were to amend line 6, change automatically enrolled to offer enrollment, I would be totally good with that, but I'm not sure that the bill is necessary.
Right. I think that if that amending it that way would make it completely unnecessary, because I would imagine that this is offered along with all the other benefits when somebody's employed as an option. So they're probably presented with it anyway. I mean, as I said, I don't have strong feelings on this. I understand what Representative McGuire and the others were trying to do. It's to change the default so people who aren't thinking about it are more likely to save for their future than not. And I have mixed feelings on that. I understand why, and that she said, she has talked with people and heard from people who didn't do that, and then later in their career, they regretted that. But you can regret any decision you make. So, in general, I'm not a big fan of nudging people to do things by changing defaults, but I'm not really opposed either. Anybody else have thoughts on this? Yep.
Yes. Are we being recorded?
I believe we're being streamed. We should be. It's a public
Okay. This is
meeting.
Representative Fellows.
Yes, I should recognize you by name. It's being a little too informal here.
I oppose this bill. I'm a retired state employee, and I was a state employee for 30 years. That entire time, entering a deferred compensation plan has been an option. They told me about it the first day, you know, on the job, and people are reminded, this is my experience, which is, you know, ended 4 years ago. But, you know, several times a year, they would send out emails that says the deferred comp representative's gonna be here, you can go talk to him. So they totally have this as an opportunity. The biggest reason I oppose making it mandatory is a deferred comp is kind of like, I believe, I don't have a 401k, but I believe it's the equivalent to that. And once you put your money into that, if you want to take it out before you get to the, you know, qualified retirement age, there is a penalty.
Right. And one thing I would say is, calling it mandatory, I'd like to suggest is not accurate, but it changes it to an opt-in. You don't have to, so it's not mandatory, but I understand.
But this bill makes it, shall be automatically enrolled on line 6.
But then you can opt out.
Right.
When you, what do you think that means?
You look at line
If
14. Look at
you-
No,
if
Sally,
both-
I mean, Representative Phillips, we're very aware of, that's the truth of anything. If you put money in a 401k or an IRA, you can't take it out.
That's the same for this plan.
Exactly. That's
Right,
exactly right. The rules, the IRS rules apply to all deferment plans, whether they're corporate or governmental or private, they're all the same.
Most of my retirement comes from what I saved in my 401k. I didn't get a pension, unless you want to count Social Security. And yeah, you put the money in, it grows. Traditional IRA, you put it in, you don't pay taxes before you put it in, you don't pay tax on the gain. You can only take it out under, if you take it out before you're 50, you have to pay a 10% penalty plus the amount you take out becomes taxable income that year at the normal rates for you. If you're over 50, you can take it out without that penalty, but of course you still pay tax whenever you take it out. The other option, I don't know if it's available for this, but a regular 401k or an IRA, you can borrow money against it, but if you don't pay it back, that's the same as taking it out, and you end up paying penalty and tax.
I don't know about that borrowing
Right.
option, but
But
state employees are automatically enrolled in the retirement system.
yes,
7% of their, well, if they're in the employee class, 7% of their salary is going into the pension fund. If they're in class 2, like the corrections officers, the troopers,
yeah,
they pay a higher rate. I don't know what it is, 11 or something, 11%, something like that. So they are well covered. They're not like the general citizen who doesn't have a pension fund.
okay. The only thing I'd point out is on line 14, it does say an employee may opt out of automatic, that's of escalation. You can opt out of the whole thing.
They're opting out of that, of changing the percent of their deduction.
Right. My understanding is you can opt out of the whole thing. I don't know if that's in,
I think it says, I'm not sure where I read it, try line 20. If an employee elects to leave the plan within 60 days, they get their money back. But if you go beyond that really early period, you're stuck.
no, I agree it's stuck in there. On line 19, it says, nothing in this section shall limit an employee's right to modify his or her contribution rate as allowed. So they can put their current contributions down to 0, but yeah, they can't get the money back.
Yes, and if they've only been in the plan for like 6 months,
Yeah.
so what do they have in the plan? Like $60, and they're stuck with that plan.
That's true, but that's an IRS ruling. It's not.
I understand that,
Okay, I just
but
want
we're
you to know
telling
that.
them, we're putting their money in certain places.
Representative Marsh?
There's no reason.
Thank you. The entire reasoning behind this bill is that it's better off for people when they're planning for their retirement to put money in early and give it more time to compound. The problem with that reasoning is it may be wrong in the case of most people today. And the reason why is many people today have high interest rate loans, particularly student loans, that they have to pay off first. And in that case, if you actually do the math, it's much better for them to pay off their loans first, which are at an interest rate that exceeds the projected rate of return of any of these retirement accounts first, and then begin saving for their retirement, which in fact is what I did There was a time in my life when I was almost $1 million in debt. I think that the basic thesis that the behavior this is trying to encourage may not actually be in the best interest of the people that it's being directed to, and that would be a very good reason for us not to make this mandatory.
Okay, anybody else?
Representative
Lanzara?
Lanzara, thank you. I agree. I believe that this should be amended if we go forward with it to make it optional, and strongly urge folks to utilize something like this. But again, my issue with it is that it's their paycheck, and what they want to do with that is up to them. And but I believe the intent may have been just that, just to urge people to look at the future and things, and what everybody else, all the other representatives said today is very accurate, I believe, and I agree with them. So I think if we were to continue with it again, we make some amendment to it to make it optional. And I just want to make certain that this isn't something that comes after maybe what the state changed in the pensions in the last couple of years. That's what I've kind of gathered from it, is maybe some of the mistakes that were made by the state in changing that pension, that this is sort of like a fallback plan. So, but with this bill in particular, again, if we could either kill it here or make an amendment to make it optional.
Yeah, I'd suggest that the default state right now is it is optional, so there would be no point in doing that. Anybody else?
Yeah, I'm actually surprised there's so much opposition to the bill, because the kind of person that's going to think about investing, as far as maybe paying off their student loan first or investing in another type of fund, would be the same kind of person that could understand to opt out of this. But, the default person that just wants to buy beer and cigarettes and they're just a kid, just to put them into something so that, they have money when they retire, it's just an opt-in. I just don't see what the problem is.
Anybody else? Yeah. Representative Grota, or Fellows, sorry.
Just to respond to your question about the problem, they can't opt out once they've been in there for 60 days. So their money has to sit in that fund. They can shut off the additional amount going in, but it sits there. If they try to take it out before they get to 50, 60 years old, they have to pay a penalty. These funds, while generally long-term, you're going to make gains. You can lose money. The value of these funds can go down. It can go down to less than you put in. And the people that this is applied to is only state employees that are full-time. And those people are already in the retirement system, and 7% of their paycheck is their contribution to the retirement system. So if you add 2% or whatever on top of this, that's even more. They are well positioned, much better than the general public, just with their retirement.
Is there anybody here who came to concerning this bill out there? Okay. Representative Santonastasso?
Every investment, you can't just take the money back out. If you make a payment to pay down the balance of your student loan, you can't later decide to take that back out. Or if you pay off some of your house, you can't ask the mortgage company to send you that check back, or any other IRA or anything else. You can't get the money back without some sort of penalty. And the second thing you were saying was, the current retirement program, I mean, as far as I understand it, it's actually under a considerable amount of debt. So it may be reasonable to have an alternative. And they can just opt out. It's just an automatic,
Representative Grota?
Okay, so we are a policy committee. So our decision is to whether or not this is good policy. And I think if I had to What my concern with, and I think it's Representative Fellows shares my concern, is that if someone is required to participate in the plan, and they have a plan, their desire is to opt out, let's say, and they don't opt out in the required amount of time, then their funds are unavailable to them until they retire. So I just want to, so really the policy that this committee has to make is whether or not requiring people, I mean, have a discussion on finance is fine, but I think it's irrelevant to the policy making. It's whether or not the committee agrees that having the state employees required to enter the state deferment payment plan with the option to opt out as opposed to the option to opt in, is that good policy?
Thank you. It's a good point. Does anybody have anything new to say, or would anyone, if not, would anyone like to make a motion?
I'd like to make a motion. I'd like
Yes?
to make a motion of ITL on House Bill.
And I will second that.
Okay. Would you like to speak to your motion? Representative Grota.
Right. I don't think that this committee should make it a policy with all the other bills that we've heard on the New Hampshire retirement systems. And I just want to clarify that the retirement system is not in debt. It is a very healthy retirement system. And we have an unfunded balance, which is going to be paid off. So all the bills that we've heard about the opportunities for state employees to have a pension plan, that at this time, it's best that we make a policy that requiring to enter the tax deferment plan is unfavorable.
Okay. Anybody else in the committee want to speak on
Yes,
this?
I will say I'm in favor of ITL, but for different reasons. I think I'm in favor of ITL because I think that this is promoting what is actually a bad policy for the young people entering the workforce, and that it's actually in their best financial interest to first pay off their high interest rate loans, including student loans, and then commence saving for their retirement. And therefore, to enroll them into an optional extra retirement plan from the beginning of their employment is not in their best interest.
In a sense, I don't disagree with you, but I think it really depends on each person's circumstance. Some people will have debt, some people won't. Certainly, if you've gone to college, some people manage it without debt, especially if you do a lot through the community college system, but you're right, a lot of people do have debt. So, again, as I say, I can argue both sides of this one, but that is a case for some people, certainly. Anyone else on the committee? Okay, if not, would the clerk call the roll?
Motion to ITL. Yeah, House Bill 1563, Representative Lekis.
Yes.
Excuse me, Representative Sanantasio,
No.
Representative Marsh,
Yes.
Representative Grota,
Yes?
and the clerk votes yes. It's 4-1. Representative Fellows?
Oh, I can't
Or
vote,
are you-
I'm not on the subcommittee.
That's what I thought, yeah, okay, very good,
Thinking of me, though.
very well. So it's 4 yea and 1 nay.
Okay, so the motion passes. And I'm closing the subcommittee work session on House Bill 1192 and opening it on House Bill 1566.
Mr. Chair, for discussion, I would move Amendment 0041H, which was brought to us when the bill was brought to us.
I'm actually looking at it. I have it in here, I'm sure. So I'm not sure I have it.
I think we got it the day that we got the bill, so
I have a copy here, thank you. So we've got a motion. Would you speak to your is there a second actually first?
I second.
Okay.
To speak to my motion, the amendment and the original bill came from the New Hampshire Prescription Drug Affordability Board, on which I am an alternate member. The original bill merely wanted to change the executive director to an unclassified position, mostly because we felt we would not be able to fill the position as a classified position, it having very unique qualifications. The amendment allows the board to not just employ an executive director, but also staff. Obviously, staff makes it easier for a highly paid executive director to do their job, and it's not prudent for the highly paid executive director to do mundane tasks like filing, for instance. The two new paragraphs added to the bill by the amendment allow us to have a fund to collect the fees that are already allowed under existing legislation to be collected, so that we can actually pay the staff and the executive director, because that was left out of the original bill when this was passed some time ago. So this was a recommendation from the Prescription Drug Affordability Board, and as a member, I think it's my obligation to bring it forward, so that's what I'm doing.
Okay. One thing maybe I should have gotten a little early. One thing I would like to say, that whatever we do with this amendment, I have some questions about whether the board should exist at all. And I intend to propose that we amend it to abolish the board. So we can move forward with this amendment and vote it on if you like, or we can deal with the larger issue.
Do you have the amendment?
No, what I would do is have the discussion, and then we could vote a recommendation to the committee that it be abolished. Then my intent, assuming we do that, would be to go downstairs to OLS and have it drafted.
And what are your thoughts, and why would you have that amendment?
So part of it, there's a number of pieces of that. Part of it's the history of how this came about. I mean, the bill was originally created in 2020 with House Bill 1280. You know, that bill came out of the House as a straightforward bill dealing with, I believe, co-payments for insulin. It went to the Senate, and then as part of their way of dealing with the whole COVID situation, which I had serious objections to, and I know some others did, they turned it into an omnibus bill by tacking a number of Senate bills onto it. It ended up being something like 7 different topics. And when it came back to the House just concurred with the Senate version. So, I mean, this whole thing got no public hearing at all in the House. It was not considered by any House committee. And so the House did not have an opportunity to give this complicated bill any consideration at all, really. And I have some concerns about the board looking at the bill. I mean, in effect, I see it as having the power to engage almost in price fixing for prescription drugs purchased by public payers. If they're not satisfied with the prices they can arrange, they can make those unavailable to patients, you know, where they're paid by public payers, regardless of whatever, you know, their doctor recommends. And then there's, you know, the board's is authorized to create a database, collect a wide range of information. They can actually sell that information, which seems a little odd to me. And you know, they can force various entities to provide that. They are empowered to assess a variety of fees on quite a few different entities. I think there's an estimate around 1,700 of them, or more, actually. And I know there's estimates of the amount of money ranging from probably $850K to $1.2 million, and it may be quite a bit more than that. This amendment would create a non-lapsing dedicated fund for the money. So basically, they get to raise and spend the money, basically pretty much without oversight of the legislature, fiscal committee, governing council, as I understand it. And I also noted that the board's permitted to deliberate in secret. They're exempt from 91A, except that decisions must be made public, and I have an issue with that. And I understand the idea behind the board, but the fact that there's nobody either on the board, not even on the advisory council, they're not, they can't have any representation from drug producers or providers to provide their view, I'm concerned about. And I also question whether the board's necessary, and the departments of insurance and HHS have been collecting, similar prescription drug information for something over a decade. And the Department of Administrative Services is currently authorized to conduct a reverse auction process to achieve lower prices for prescription drugs for the health insurance plan administered by the state, and it's my understanding they have successfully done so already. So that's my reasons for proposing an amendment to abolish the board. Representative Marsh.
Thank you. I would oppose efforts to abolish the New Hampshire Prescription Drug Affordability Board. I believe that this is something that Governor Sununu has supported. It's something that's being done in our neighboring state of Maine. It's well developed in the state of Maryland. My constituents and my patients really want us to do something about the issue of rapidly rising prices of prescription drugs, particularly when they're rising on drugs that have been out for a very long time. It's not new research. This is not new developments. It's not troubles in the supply chain. It's just that they have pricing power in the current economic environment. This board is digging into numerous issues in the supply chain for prescription drugs, some of which are extremely confusing. It's not a simple free market economy. And I think without this, the New Hampshire consumer and our constituents will remain at risk for being gouged for prescription drug prices. So I will very much oppose a move to repeal the Prescription Drug Affordability Board.
Representative Fellows?
Thank you. So I have a question. I would like somebody to tell me specifically what drugs this applies to, because my thought was it has to do with the drugs that the state would be buying or that would be part of the Medicaid. And it's not, it wouldn't impact any costs that I would pay for drugs. So
My understanding is it's any, it's actually drugs purchased by the, I've got the statute here. Representative Marsh might actually be able to offhand give a clearer answer to that question. But I've got it here. I believe I brought the statute. But it's drugs that are purchased by plans that are administered under the control of the state. So, I mean, if you're not getting medical care through any of those, then no, I suppose they would not affect you directly. Anybody else? What's that? Oh, sorry. Yes, Representative Fellows?
So, thank you. So the other thought when I was looking at this, I think maybe I did the same thing you did. I went to the HHS website. I found a place where they were collecting information about drug prices, and it, it looked like the collection that they would get from these pharmacies looks like a spreadsheet with, each drug, you had to list it and, what the cost was, and maybe like 4 or 5 things. Just numbers, just spreadsheet. And that most of the work, I'm wondering if most of the work of the board is mostly just like clerical and compiling the data.
Representative Marsh?
That's just one thought.
Yes, I just want to refer to the statute here. If you look at 126 BB5 Roman 4, I'll just read it so that you know. It says, by November 1st, 2020 and annually thereafter, the board shall report its recommendations, including prescription drug spending targets, their strategies for optimization of the affordability of prescription drugs for the state and all of its residents, the progress of implementing those recommendations, as well as the annual net spending by public payers on prescription pharmaceutical products as a measure of the efficacy of implementation of those recommendations to date, to the standing committees of the General Court with jurisdiction over healthcare coverage and insurance matters, and to the governor. I would say, based on that charge, that this is intended to address the cost of prescription drugs, not just for people who are funded by public funds, but for all of your constituents.
Okay, although in reading it, I've got it in front of me now, I believe it's given particular powers around negotiating prices for drugs purchased by public payers, and in 126 BB1, the definitions, Part 6, or Roman 6, it says public payer means any division of state, county, or municipal government that administers a health plan for its employees, or an association of state, county, or municipal employers that administers a health plan for its employees. But I agree that it is charged to do reporting on larger issues, but it doesn't have that
I would
direct
agree
control.
with that, yes.
Yeah, okay, thank you. Anyone else?
I'm sorry, I would be against dissolving the board.
Okay, thank you. We've got a motion on the table that's been seconded for this
The amendment?
amendment 00418, so, unless people want to withdraw it, we can vote on that.
I'm happy to vote on the motion if that's the chair's wish.
On the amendment. Okay, so why don't we do that first? The questions on adopting the amendment 00418 to House Bill 1566. Any discussion on that specifically? Okay, seeing none, clerk call the roll.
On the amendment 0041H, Representative Lekis,
No.
Representative San Antasio,
No.
Representative Marsh,
Yes.
Representative Grota,
Yes?
and the clerk, yes.
Okay, three to two, the amendment's adopted, or at least we'll recommend that it be adopted. And actually, I think if we're going to follow the tradition, if not rules for the committee, normally you ask the chair last for their vote. I'm not making I don't know that it's a motion, but it's, I guess, a motion that the subcommittee recommend that an amendment be created and adopted to eliminate the Prescription Drug Affordability Board. And any further discussion on that?
I'll second it. You're making a motion.
I'm sorry, yeah, seconded. Okay, thank you.
Mr. Chair, may I ask for a clarification?
Certainly.
Is you that you wish to make an amendment to repeal RSA 126-BB?
That's correct.
Thank you.
I believe that's all of the statute concerning the New Hampshire Prescription Drug Affordability Board is in there.
That would be correct.
Okay, I was going to ask OLS to make sure that was the case, but yes. Anything else? Okay. If there's no further discussion, would the clerk call the roll?
Representative San Antasio,
Yes.
Representative Marsh,
No.
Representative Grota?
No?
Clerk votes yes. And the chair,
Yes.
3-2.
Okay, that motion is adopted, and I'm going to close the work session on House Bill 1566, and we're done. Thank you.